Hello, my name is Dr. Alexander Kutikov, and I'm a urological oncologist at Fox Chase Cancer Center. Prostate cancer is the most common cancer found in men, but not all men diagnosed with prostate cancer need immediate treatment. For many of my patients, I recommend active surveillance, a monitoring regimen that tracks any potential cancer growth without administering treatment. I have found that this process can be extremely stressful for my patients. That's why we're working with doctors from Northwestern University and other medical centers across the country to provide a clinical wellness program that teaches patients how to reduce stress, support a healthy lifestyle, and bring about a good quality of life. It's called the Reassure Me program. The program is offered to patients and their spouses or partners free of charge as part of a clinical trial sponsored by the National Cancer Institute. If you're interested in joining this program in Philadelphia, or you have additional questions, call 888-FOX-CHASE.
Hello, my name is Dr. David Victorson, and I'm the principal investigator of a National Cancer Institute-funded research study called Reassure Me, which is specifically for men on active surveillance for prostate cancer and their spouses. Our team at Northwestern University is working closely with your urologist's research team to help bring this study opportunity to you. In this study, we're testing out 2 different 8-week health promotion training programs to learn if they can improve a person's health-related quality of life and well-being, and if so, how. Knowing more about how these programs work can help us determine how we can make them more readily available to men on active surveillance and their spouses all across the country. If you're interested in participating, we will ask you to complete an online survey, which should take no longer than 30 minutes. The survey asks about your socio-demographic background as well as other questions about your quality of life, health behaviors, and other possible symptoms you may be experiencing. After completing the assessment, a research coordinator will randomize you to one of 2 8-week health promotion courses. One is a treatment group and one is a control group. They both aim to teach skills in how to improve and maintain health and well-being, as well as how to make sure these lifestyle changes remain long after the course ends. Both groups involve attending a 1-hour orientation, followed by an 8-week course, which meets weekly for 2.5 hours. At the beginning of each class, we'll provide a light, healthy meal, and then near the end of the course, there is also a 4-hour weekend retreat session to practice all of the different skills that have been learned. It's intensive, we know, but after doing this work for several years now with other groups of men on active surveillance and their spouses, we have learned that in order to make important health style changes like this, it's often necessary to make these kinds of investments of time and effort. After the 8-week program, we'll ask you to complete the same 30-minute survey that you did in the beginning, and we'll also ask you to complete it again 6 and 12 months after that. We do this to see if the program had any long-lasting effect. By participating, you'll also agree to allow us to review your medical chart so we can better understand your overall health status, both at the beginning of the participation in the study and then annually throughout the remaining years of the study. This is pretty standard in medical research, and we can assure you that we abide by the highest security and data protection standards to make sure your information is only seen by authorized research personnel. Even though the 8-week course is being offered for free, we also want to thank you for taking the surveys, so you will receive $25 after completing the 6-month assessment and another $25 after completing the 12-month assessment. Participating in this program is completely voluntary and is totally up to you. You can choose not to take part. You can agree to take part and later change your mind. Your decision will not be held against you in any way. You can ask all the questions you want before you decide. If you are interested, please follow up with the person who provided you with this video. We want to thank you for considering being a part of this study and wish all the best to you.